We have good news for you if you're a senior and you have sciatica. Now, almost all sciatica is either from a disc problem or stenosis, particularly if you're a senior.
And in this video, we're going to show you how to differentiate between the two and show you some relief options.
That's right. And because sciatica almost always originates in the low back, we're going to address back belts and are they good for you or not? There's always a controversy. We will explain it.
Bob and Brad, the two most famous physical therapists on the internet.
Welcome to the Bob and Brad channel. We are the most famous physical therapy team on the internet.
In our opinion, of course. And if you are new to this channel and happen to like this video, please subscribe and comment.
That's right. And naturally, we have our continued goal of keeping you healthy, fit, and pain-free. Let's go.
Let's get into it. So first, we're going to define what sciatica actually is.
Sciatica is a term referring to pain. It typically originates in the back, goes down the leg, past the knee, and it can go to the foot. Anywhere in between there, that's the sciatica because it's a nerve being impinged up here that travels all the way down to the foot. Great toe, actually.
Now, there are two common issues that can cause sciatica. The first one is a disc problem. People will hear herniated disc bulge. They're pretty much the same thing. Basically, that is when your disc is actually protruding backwards, hitting a nerve root, which we have right there, and that is causing some pain referring down your leg.
That's right. Now, stenosis, which is very common in people in 60 and over, oftentimes, oftentimes without symptoms, is simply stenosis refers to a hole or a foramen, which is the hole here where all these nerves exit. One of them has become smaller, and when that happens, the nerve gets pinched, just like when the nerve gets pinched from the bulging disc.
Now, most people can get a diagnosis through an MRI, but we realize those are pretty expensive. So we're going to talk about some common symptoms each present because they are different.
That's right. I personally have had both and had many patients with these common symptoms if you have a disc problem. And these are a little bit variable, but generally speaking, if you're sitting for long periods of time and you get pain down your leg and then you stand up and it even hurts worse, that's common with a disc problem, particularly if you walk around and after a while it seems to improve. Now, if you have stenosis, it's when you stand or are working overhead, the pain in the leg and the back typically get worse. And when you sit down, the pain very quickly subsides, particularly if you squat lower. So, keeping that in mind, we're going to continue on.
Another common sign of stenosis is that you feel better when you are forward flexed when you are actually walking. Oftentimes, if you use a shopping cart at the store and you lean forward on it, or maybe you're using a walker and you feel a lot better when you bear some weight through your arms and walking, oftentimes this is a sign you have stenosis.
And they actually call it shopping cart syndrome. That's just one of those things that's very common. Let's go on with some exercises. Mike, can I jump in there or actually lie down in here?
Yes, you can. Don't jump. You've broken the mat twice this year.
Well, if you have stenosis or you wonder if you have stenosis and you lie down on the floor, or you can do this on your bed, actually doesn't matter for stenosis, and you grab your knee and you pull up like this and it's like, that feels kind of good. The other knee feels good when you pull up and then you actually go both knees and it actually feels better. That's a good sign you have stenosis. You still could have a disc problem, but that's a pretty good sign. And then after you do that, you get up and it feels pretty darn good. It's probably stenosis. I know when I used to have my stenosis, I could walk for about 3/4 of a mile until I got pain and sciatic down my leg to the same area into my shin, L5. I know that because I'm a therapist. You don't have to know that. And I would squat like this right on the road. Pain would go away. It'd feel much better within seconds. I'd stretch like this for about 30 seconds. I could get up and continue to walk much farther. And I actually got rid of it through a series of exercises, but it took some time. That's for another video.
Another common stretch you can try and do is sit down in a first firm chair, we're just on the plinth for now, but if you end up reaching down towards your toes or flexing your spine more, normally this will feel better, and then you can kind of come back up and just do some repetitions. This is a good stretch to try to do if you have stenosis.
There you go. Now we're going to change up. We've got a couple simple exercises for a disc problem. All right, one word of warning, whether you think it's stenosis or sciatica. If your symptoms are so serious that you have pain and numbness, tingling down your leg to your foot, and it's difficult to walk as a result of it, it's too serious. No self-treatment. Go in to see a doctor. Hopefully you'll get connected with a therapist to get some more specific treatment. But if it's mild and it's irritating you, I think this is worth giving it a try if you follow the rules, as we say. They should make your leg feel better quickly during the exercise and afterwards. Now let's go to this for typically a disc problem or one-sided back and leg pain.
Yes, if I had left-sided back pain, what you can do is go up to a door frame, pull-up bar, whatever you have that is handy and you can reach. Make sure you're not hanging all the way off the ground with this. My feet are touching. Your door frame would fall off.
I'll show them the stick option.
So what you can do is reach up. My palm is facing away from me, and then I'm going to just bend my knees. You're going to feel a nice stretch in your lats here. You're actually decompressing your spine, letting room to breathe for that disc that may be problematic and pinching on the nerve. So it should feel good right away. I'll just show you from the other side so you can understand how this is stretching in here. Well, hopefully your door frame doesn't move like ours, but just feel that stretch. You can do it 2 to 3 times for 20 to 30 seconds. Breathe throughout, or you can do it throughout the day if it feels good, because oftentimes when you sit down again with a disc issue, it kind of bothers. So that's an option for some quick pain relief. Some people can't reach that high though, so you want to show how they can use a stick?
Yeah, a good option for this is if you just have a good solid stick, a broom handle, piece of doweling or PVC, about 1 inch in diameter. You put that up on a solid cupboard surface, a stool, something that's solid. And if it doesn't have a rubber end, which a lot of times it will happen, take a shoe and put that right there so it doesn't slip around. It has to be solid and stable. Again, hand away from you, reach up as far as you feel comfortable, and then the same thing what Mike was talking about. This is the painful side with all the symptoms going down the leg, and you should feel relief right away as you do that stretch. It's a decompression or a little traction, and if it makes it worse, it's not for you. Stop it, and we'll go on and show you some other options. So that's the same as that. The other thing is if it's one of these problems, and this is pretty common when you have sciatica from a disc, is when you feel the symptoms going down the leg, if you walk on a flat surface, a nice steady pace, it's a controlled walk, and the longer you walk, it actually feels better, the leg's feeling better, that should be your treatment. Now, I'm not talking about a 3-mile walk. It may only be 200 or 300 yards to start with, may feel better, but then as you fatigue, it's not so good. So you need to go out and then come back like a circle around the block versus going out a half a mile, and then you're getting fatigued and you can't make it back. So use good judgment with the walking. And then the last thing is if you feel better lying on your stomach,
I'll move
like this, and that's a really good sign it is a disc problem. And we can treat it that way, just lying like this. And you can start some press-ups. Now, I'm not going to, there's a whole series of exercises if this feels good. I don't want to go with it here. If you go to Bob and Brad on YouTube and put in sciatica, there's a number of videos that go through further involved treatment to do that. Sometimes just lying on your stomach, going up a little bit, allows it to relieve, the leg pain goes away. Get up and continue on. The door stretch would be a good one to work with that. Okay, let's address back braces or back supports. Are they good for you or not? It is controversial. We're going to give you our professional opinion, and I think it's a good one. So we're looking at, this is one of the back braces we're going to talk about. First of all, the typical back brace wraps around and it mechanically supports your back. But at the same time, your core muscles, the muscles around your stomach and back, they support your back. So this actually compromises the muscles, and the muscles can get weak if you wear a back belt all the time that is snug. That's why we don't recommend those, but the back belt that I have on and Mike has on are adjustable. In other words, look at this. I have this one relatively loose right now, and I can easily tighten it up. Now, this is quite snug. It's supporting my lumbar spine very well, and I would like this if I'm going to do some chores for 20 minutes, lifting some things, going for a walk. I used to use this riding my bumpy riding lawnmower because it bothered my back and it gave it support. But I only did that temporarily. When you're done with your chore, you simply loosen it up so you can breathe better. Your muscles take over the support, and it's very nice. And there's a lot of different varieties of adjustable back belts. This one has a very strong mechanical support. Mike has another one, which I like as well, but it's just different.
It's much thicker in comparison. Brad's is thinner. I can't bend over as far forward with this one. It's going to cause me to have a flat back when you are hinging down, which can be helpful to some people. Or if maybe you're a larger person, you may just need more support. But it's the same concept. You first just put it on, and then this strap doesn't have the strings. They're just elastic stretchingness, but you can still get it nice and tight. Now, make sure when you get a brace to read the measurements, because oftentimes they have different size options. This one's pretty big for me. I wouldn't need one this long because look how far over I have to pull this to get it tight.
Yeah.
So those are just some good options. But yeah, if you are seated or resting, either loosen it up or just take it off and maybe put a little pillow behind your low back, especially if you're driving as well. You don't want your core to become weak, but you also don't want to have too much pain.
In regards to seated position, I would not even use or even have the back belt on. So take it off. Particularly, people may ask, well, my back bothers me when I sit for a long time, like driving in the car. Then you need to address the back using a lumbar support. We could simply use a throw pillow, a full-length pillow, or a specific lumbar support, which we do have videos on for detail. YouTube channel, Bob and Brad, seated lumbar support, and you'll get good detailed information on that. Now, the third type of back brace that is actually more of a therapeutic back brace because it offers 3 different therapies at once. It does offer some lumbar support, but not as much. It's more for therapy. You can see here we have red light therapy, which you can turn on and off, and it has 4 different intensities. Now, the red light does not heat up. There is another button that controls heat if you want heat on your back. And then also there is a massage component to it. It's not a deep massage, it's more of a vibration massage. And the big benefit of this is it's cordless. It has a battery here. Now, actually, this is a Bob and Brad back belt, which means I personally have tested this. There you go. And it does turn off automatically after 15, or is it 20 minutes? One or the other. I don't have it memorized. And it feels good. I used it once after doing yard work, which typically irritates my back. I did it on purpose so I could test it out. I used it. I had good results with it. There's no guarantees that that's going to fix your back, but that what it has to offer. Back belts are relatively cheap in the big picture of back pain. I can't guarantee you're going to have 100% success, but I have worked with them with success. Work with them as we just instructed. Instructed. Is that the word I'm thinking of?
Sure, I was going to say disgust, but okay. This feels pretty nice. I'll just sit here all day with this on.
Yeah, it is.
That's nice pulsating on my back, and it's plenty warm. I mean, I cranked it up to max and everything, because that's just the way I am. But
there are few back belts, if any, that have the heat component, which a lot of people respond well to. Typically use a hot pack that you plug in or you heat up in the microwave, which they are very limited. This is nice. You can walk around with it.
Yeah.
All right. So we've talked ad nauseum about all the things you can do with sciatica pain if you're over 60. We do have another video to continue it if you're really having a good time. What's the name of it?
I don't know, because our smart board just decided to turn off and you started talking. Easiest spinal decompression routine to stop back pain. More if you have sciatica issues. You can check that video out. And I'm just going to hang out with this thing on me.
Yeah, we really talk about some ways to do decompression or traction at home without any expensive devices. Okay, very good. Be careful and keep your sciatica under control. I'm out of breath.
Bob and Brad, the two most famous physical therapists on the internet.